Hey, good evening, everyone. Thank you to everyone who has joined us this evening for our webinar on taking basic blood samples in exotics. So I'm Zoe. I work here in the business development team at the BPG, but I also do have a background in conservation and wildlife medicine. But the talk this evening will be taken by Dr. Ian Sayers. Just a few things to run through before we get started. So the webinar this evening is being recorded, and a recording will be emailed to everyone who has registered. For those of you who have joined it live tonight, will be sent a CPD certificate as well. So we do have everybody on mute just to reduce any background noise, but we will have time for questions at the end. Please post your questions on the little question tab if you can see that, and then we'll go to the questions at the end of that. But please do post them as we go along. If there are any technical issues, and please do bear with us, we'll aim to get back up and running as quickly as possible. So just give a bit of background about Ian, who'll be giving the talk this evening. So he graduated from Liverpool University in 1992. And throughout his varied career, he has worked in mixed practice. He's worked in Serengeti researching cheetah. He's been a self-employed locum and a clinical fellow at the University of Bristol between 2001-2010, teaching first opinion practice and zoological medicine and surgery at the first opinion practice and referral levels. He's been integral to the setup and running of the UK's first RWAF rabbit-only referral clinic. He has supervised residencies, contributed to publications, and lectured nationally and internationally. He was a guest lecturer in rabbits and exotics at the RBC between 2009 and 2018, and he gained the RCVS certificate in zoological medicine in 2006 and was registered as a Royal College Advanced Practitioner in Zoological Medicine and in 2015. He has worked with and consulted for a number of zoological collections. He is now based in South Devon, where he sees first opinion and referral exotics via consultancy within a small animal practice. He is a veterinary consultant to the Sheldon Wildlife Trust and is also our exotics clinical consultant here at the Veterinary Pathology Group. So without further ado, I'll pass you on to Ian. Please do post your questions in the question box and we'll answer those at the end. So Ian, over to you.
Good evening, everybody. Thank you for giving your time to listen to us. Hopefully, tonight's going to be basically a very practical evening is what I'm hoping for. The feedback I get from a lot of students when I was teaching and from vets in practice is there's a degree of fear of how do we actually get blood samples, how do we work up exotics. As soon as there's not an exotic, or rather as soon as it's not a dog and cat and it's an exotic that's on the diary coming in, the hand reaches for a certain antibiotic, and I'd like to say that enrofloxacin is not a clinically recognised syndrome. There are things that we can do to investigate, to do investigations with a lot of exotics because they hide signs of disease. We're often doing an initial workup, which will involve diagnostic imaging, blood sampling, and those sorts of things. And yeah, blood sampling of exotics, it is a skill. It is a skill set that you need to learn, but it's not that difficult. So yeah, it is easier than trying to get blood from a stone. So tonight I'm going to try and take the fear out of how to get a blood sample from commonly presented exotics that are seen in first opinion practice. Hopefully there's a few practical tips thrown in that will help you obtain these blood samples in the first instance. I'm going to demonstrate, well not demonstrate, illustrate which vessels that you really need to aim for, where they are, how to see them in the various species in order to get the blood samples from them. And once you've got the blood sample, how to handle it, what to do with it, things to try and avoid, things to do with it. And I'm trying to encourage you to actually start thinking about it. No, in some ways, no different from cats and dogs. Yes, there are differences, but in other ways, they've still got the same blood vessels in other places. Being able to see them, not quite so obvious, but practice taking them, start it basically to try and give you confidence to start making it part of your diagnostic workup of exotics. So the first thing is, what do we need to know about them? They're not a dog and a cat, so what do we really need to know? Well, we need to know what equipment we need. We need to know how much blood we can or we should take. We also need to know how much does the lab need to make it worthwhile. I'll be very honest, and from the get-go, I see a number of budgies and smaller birds, cockatiels, which I'll be honest, I don't end up taking very many blood samples from. On the flip side of it, when I've got my VPG hat on in the afternoons, I see a number of blood samples that are submitted by clinicians that are possibly, potentially you could argue, a bit more proactive than I am. But because purely from the physicality of the size of the patient, we can't take enough. So within the profile itself, there's often a line that says insufficient sample, insufficient sample. If you discuss that with your clients in the first place, with your owner, and you say this is likely to happen, so that they're giving you informed consent to take the blood sample in the first place. Informed consent is important at so many levels with what we do within the profession. It may well be that you end up having to do serial sampling. If you've got a small sample, ring the lab first of all and say, these are the clinical signs that we've got. These are what we're, so perhaps you've got a bird that's drinking a lot. You think we might be concerned about kidney issues. Ring the lab before you send the sample in, say, or put it on the lab form as well and say, can you prioritize the renal parameters? That way you might hopefully get more information without having to serially sample your patients. Generally speaking, for a typical profile, the lab needs a minimum of about 0.75 mils in HEP to get a full heme and a biochem and ionized calcium. But that can depend on quite what the plasma yield is from the sample. So if you've got a dehydrated patient, the yield will be less. And like I say, if you only get a small sample, contact us and we can try and prioritize the samples in the first place that fit the clinical picture. We then need to think how easy it really to sample them. It's not that scary. Not necessarily that easy, but it shouldn't be that scary for you. It can be more challenging than it is in cats and dogs because a lot of the time, I mean, I only see exotics in the UK now. I do dogs and cats when I help a charity that I work with in Lebanon, but in the UK, I only see exotics. So for me, it's what I'm doing day in, day out. It's like every procedure that you're doing, doesn't matter whether it's a cat castrate or some fancy endoscopic procedure, the more you do, the more familiar you are with it, the more successful and therefore the easier it will become. So a number of times the vessels that we're aiming for, they're not necessarily easily visible, and some of them they can be blind sticks. So if we're going for example, a saphenous vein in a lot of zoo species, we're feeling in the femoral triangle, feeling for the femoral pulse. We know our anatomy so that we know that where the femoral pulse is, that's the femoral artery. Next to it should be a femoral vein, and very close to it is the femoral nerve. We're feeling for where the pulse is, we're aiming for somewhere near it, and hopefully we hit the femoral vein and we get a good blood sample. So it's these sorts of things that we need to be aware of for the anatomical approach. As a general thing, personally, as far as, this is where as the speaker is concerned, whoops, get my thing from the screen, as the speaker is concerned, I find, or visually, that reptile blood often appears thinner / a bit more watery than it is for mammals. The reason I point that out is that particularly for reptiles with some of the sample sites, there is the risk of hitting lymph sinuses or lymph vessels, so you can get lymph dilution, and that will impact on the values that we actually get on the results. Sometimes that will be evident on the hematologist actually looking at your blood smear. There are various appearances that can show that will make them suspicious of, but it's something to be aware of. And generally, as we said earlier, with exotics, phlebotomy is parcel of the initial case workup. So ideally, trying to do it when you are doing it, do it as early as possible. So for example, if you've got a bird in, you've got your African grey, you're doing a workup, so you're planning to anaesthetize it, to x-ray it and things. Once it's asleep, enough for you to get the blood sample as early as you can, and therefore the impact of anesthetics and things like that will have less effect on the values that you're getting. Anesthetics have an impact on blood values for any species, but we're trying to minimize that. I often, well, with my parrots, for example, I will anesthetize them to blood sample them because it's less stressful both for the parrot and for me, because some of them really don't like seeing me once I pick them up in a towel. They wriggle and move, and that can create more problems than it's worth. And although there is an anesthetic risk with any anesthetic, and you get some clients that think put a bird and an anesthetic in the same county, let alone the same room, the bird's not going to survive. That doesn't necessarily need to be the case. There are some exceptions, but please don't be afraid of it. And the more you do, the more you're familiar you will be with getting the birds asleep quickly. And as a general rule, Speed it's not a competition, but if you're prepared in advance, I can often anaesthetize, bleed, and X-ray parrots in around about 15 to 20 minutes. So it's not an excessively long procedure, and therefore the risks are reduced. Asepsis is important in all species, as it is in cats and dogs, but for some species may be harder to achieve. So you need to remove growth contamination, and that will vary significantly depending upon the sample site you choose from. Typically, I would say if you're going for a tail vein, a dorsal tail vein on a tortoise, which I generally don't go for, there's going to be a lot, or the potential for a lot of fecal material around it, particularly by the time you grab the tail and it's not happy with you holding it. As a general rule, the cutaneous bacterial load on avian skin is less than it is with reptiles. Then a wipe with a small amount of spirit on a swab is usually adequate, similar to mammals. For reptiles, though, it is important to spend sufficient time cleaning the skin with whichever skin scrub you choose. I'll be honest, I tend to use an iodine-based scrub, and use a soft brush or a toothbrush to make sure that you're cleaning underneath the edge of the scales to remove growth contamination. You want to avoid the use of a lot of surgical spirit, or excess use of surgical spirit, I should say, when you're dealing with reptiles, whether it's for blood sampling or for surgical preparation, because you want to minimize the potential of heat loss, because as the spirit evaporates, it will take heat away. But generally, a final wipe with a lightly dampened swab with a bit of spirit is totally acceptable. So as we can see here, we've got a bearded dragon that I'm preparing to do a tail vein, ventral tail vein or coccygeal sample. It's on a snuggle safe to keep it nice and warm. I'll talk about later about having them in their preferred body temperature zone. But as you can see there, it's totally unfazed really by us holding the tail. It's not me that's deformed with 3 hands. I do have an assistant in this situation for taking the picture, but we're giving a good scrub with a diluted iodine to make sure that we can minimize potential infection problems. You then need to know, how much can you take? Well, theoretically, if you're good enough, nearly all of it, but that's not in the best interest of the animal. We still need to leave enough of the red stuff pumping around the beastie in order to survive the consultation. The figures that we'll talk about later, we'll talk about up to 10% of the circulating volume in a healthy animal. But let's be honest, if it's a healthy animal, why are we blood sampling it? Most of the patients that we deal with, we're suspicious there's something wrong with them, so they're not healthy, so we need to bear that in mind. If it is a healthy animal that we're routinely blood sampling, I would say that we probably need to consider having an ASPA license, but let's move on. So what we really need to ask is, how much of it can we take safely? As I just said earlier, generally speaking, we talk about taking 10% of circulating volume from a healthy animal, and generally speaking, that's a reasonable approach to have with the patients that we have. But we also need to bear in mind that, are we likely to perform any subsequent procedures? For example, surgery that may entail blood loss. So if we take 10% for our blood sample with the plan to operate on it the next day, it's not going to really have regenerated that blood volume sufficiently. So the amount of loss we might have at surgery, we need to be aware of. There is also, we need to be aware that we can get in some sites, unfortunately, we can get some quite significant hematoma formation. Some of the sites that I'll mention that I use routinely, it is unusual, but it is not unknown for there to be significant hematoma formation that animals will effectively bleed out at these sites. So don't be blasé about it, but as I said right at the beginning, don't be scared. So before we know that we can take 10% of the circulating volume, we need to know, what is the circulating volume? So for reptiles, we're looking on average of about 5 to 8% of the body weight. For birds, we're looking at around 7 to 11% of body weight. And for mammals, not dissimilar to reptiles, we're looking again at about 5 to 8% of the animal's body weight, which therefore equates to 10% of the circulating volume for reptiles is between about 0.5 and 0.8 mils per 100 grams, or between 5 to 8 mils per kilo. It's the same maths, it's just in different representation, whichever works for your mind. For birds, you're looking around about 0.7 to 1.1 mils per 100 grams, which equates to 7 to 11 mils per kilo. And for mammals, same as reptiles, 5 to 8 mils per kilo, or half to 8.8 mils per 100 grams. As I mentioned before, we don't want to take too much. We need to bear in mind that generally we get circulatory failure occurs at around about 15% of the loss of the total circulating volume. So going back to what I said earlier about the smaller budgies and cockatiels, or even if we're looking at smaller reptiles like leopard geckos, I see a number of them that are like 40, 50 grams. That's quite a challenge to get sufficient blood from them in order to meet the 0.75 mil that the lab needs to do a profile. So we need to discuss that with clients, what we're likely to achieve, that we might need to repeat blood sampling and to do other parameters and those sorts of things. So bear it in mind. So to try and put it into illustrate it to you, just how much can we lose? Let's look at a number of different species. We'll take an average of 70 mils per kilo body weight. They're all mammals. We said about 5 to 8%, so 70 mils per kilo. So if you look at a body weight of a large mastiff type dog, we're looking at about a body weight of 50 kilos, 1 to 3 kilos for a typical rabbit, and around about 30 grams for a standard mouse. So that equates roughly for the large dog about 3,500 mil. That's 3.5 litres of blood that you can lose quite happily. Which, if you want to put it into other illustrative terms, you can lose a lot of blood onto the floor of the op room or into the dog's abdomen during a splenectomy, or as frightening as it is, during a spay, before we actually need to worry about this dog going into circulatory collapse. If we look at a rabbit, we're looking at, again, 70 to 210. It's significantly less as a total volume. And if we look at the mouse, 2.1 mils as a typical circulating volume or blood volume for a mouse. If you think a standard square 5 by 5 centimeter gore swab absorbs 5 mils of blood, that's the total circulating volume of 2 entire mice. So if you're doing small mammal surgery, you need to have appropriate sized swabs as well, so that we don't just absorb it all out of them. We said before about the 15% loss that can result in circulatory failure, and therefore basically circulatory shock and shutdown. So overall, we're looking at around about 0.3 for the mouse, which isn't a great deal. That's nowhere near the 0.75 mil that the lab needs for a heme and biochem profile. So we need to bear that in mind. For your rabbits at 10 to 30 mils, that shouldn't be a problem. And crikey, not quite gallons to spare for the dog, but it's that sort of perspective that we need to think of. So now we know how much we can take safely and how much the animal can afford to lose. How are we going to get the sample? So what equipment do we need? Well, comparing to cats and dogs, to be honest, nothing special. The important thing is to have all your equipment ready in advance. If it's all to hand, you're going to be able to get your sample more quickly, more efficiently, and more smoothly. But what equipment do we actually need? Well, number one, fresh smears or blood smears taken at the time of sampling are invaluable, and I shall talk about that more a bit later. So you need blood slides, or microscope slides for your blood smears. Nice and clean, ideally degreased. You're going to need a bit of cotton wool, probably not only to be able to give a little bit of a wipe with spirit beforehand, but also to put on the phlebotomy site afterwards to aid hemostasis. You need to be able to clean the skin with a appropriate cleaner and or a little bit of spirit. We're going to need appropriate size syringes, and we're going to need appropriate size needles. So if you actually just look at the list here on the left-hand side, it's no different to what you should be getting out to sample your routine cat and dogs. But okay, you might be using some things that are a little bit smaller than you might use for your typical cat or dog. Other than that, it's the same. So don't be scared. I just alluded to the needle size. Basically, we want to use a needle size that's as large as possible so that it helps with the laminar flow properties. It's not affecting the blood flow and the sample size, and we're not ending up potentially causing hemolysis because it's coming through too small a needle. But equally, we need it as small as necessary. Some of these vessels that we're aiming for ain't real big, but we want to fill the vessel as much as we can. So as a general rule, we're using needles of between 22 and 27 gauge. If you use too small a needle, thinking, oh, I'm a bit frightened, I'll use a little needle, you'll end up affecting laminar flow characteristics and increase the risk of cell lysis. And if it's not coming fast enough, you might be more likely to promote clot formation. You need to have an appropriate size syringe. If you have a too big a syringe, even a small movement of the plunger can result in quite a significant change in negative pressure, which can result in vein collapse if it's a small vein. So as a general rule, for most of my exotics patients, I'm using a 1 or a 2.5 ml syringe, and I'm using a blue or an orange needle. And very, very occasionally, for either juveniles or very small individuals, I'll use a 27 gauge. The approach angle, that depends upon the site where you're aiming for. What can sometimes help you significantly is by aseptically bending the needle so that the needle changes, the angle of the needle in relation to the syringe helps you access the vein better, because you might only have a small bit to get between the leg and its head to get to its jugular, for example. So in order to do that, it's quite simple. You can gently lift the syringe cap off the syringe, but not exposing the needle. You can then gently apply a little bit of force onto the back of the needle, avoiding blunting the bevel, so that you get a little angle of the needle. That can help. This is all done without touching any of this bit, therefore we're not affecting the asepsis. Before you take the sample, it might sound silly, but make sure, move the plunger up and down within the syringe, because once you're within that vessel, you don't want to move your needle around, and I'll show you why in a moment. If you've not made sure it moves, basically if it's been sat on the shelf, the interaction between the plastic of the syringe and the rubber of the plunger, it can make a significant sort of drag before it starts to move. So make sure it's freely moving before you actually stick it in the animal. I've put on here pre-heparinization. It's a question that we get asked, not infrequently. And yeah, the question is, to heparinize or not to heparinize? Is that really the question? And I apologize for bastardizing Bill Shakespeare, but is it really the question, to be honest? I don't think it's a big issue. I don't do it personally. However, if you are concerned and you do pre-heparinize your syringe, once you've obtained your sample and you've agitated it within your syringe to make sure it's not clotting, place the sample in a plain tube rather than put it in a lithium heparin tube, because by adding the further heparin, you can dilute your sample further and therefore will get artifactually lowered results. When you're taking a blood sample, make sure you're in a comfortable, or let's be honest, as comfortable a position as you can. You want to maintain stability. Once you're in, you don't want to be moving that needle around within the vein, and again in a second or two I'll show you why. We want to make sure that when we penetrate the skin, the needle bevel is uppermost, so that the furthest point has already gone in before the other bit, so we're reducing the risk of trauma to the vessel. Once the bevel has passed through the skin, that's another reason for it being uppermost, we can see that it's under the skin, we can then put a little bit of gentle negative pressure on the syringe plunger, and therefore that helps identify vessel location. So if there's we're not talking about massive suction, but a little bit of gentle negative pressure means that once we get into the vessel sufficiently, we'll get a little flash of blood within the needle hub. We know we're in situ. We can then keep everything stable, maybe advance just a smidgen more, and then we can withdraw keeping everything in a relatively static position. If we keep everything static in relative to the animal, we're going to avoid vascular trauma. Why is that important? Well, if we look at this, even the 27 gauge needles under a microscope, they're pretty sharp. If they're wiggling from side to side within a small vessel, it can be a little bit like having a knife and jiggling it around. We're trying to minimize post-sampling hematomas, trauma to the vessels for the longer term. So once it's in, keep it still. It's when we're using it, even if we're using a 22 gauge in a cat, in its jugular, there's a big area beyond the needle that it can move around without actually lacerating the jugular wall. We don't have that luxury in a number of small species. So once you've got your sample, remove the needle and gently place your sample into lithium heparin in the sample pot. That's for the reptile and avian species. EDTA causes hemolysis for a number of reptile species and avian species, not all, but a number of them, so it's the safer one to choose. If you've got sufficient blood then from a mammal, then you can put it in an EDTA tube as well. But a lot of the small things that we're dealing with, whether it's beardies or whatever, we don't have necessarily that much to spare, so stick it in a lithium hep, unless you've already pre-heparinized, in which case stick it in a plain tube. Ideally, make at least 2 fresh blood smears as soon as possible. Manual hematology is done for reptiles and avians because the red cells contain nuclei, which means that we can't use machines because machines can't tell the difference between a red blood cell and a white blood cell. Fresh smears that are made at the time have better staining characteristics and are far superior than those made from lithium heparin. The more you do them, the more improved you'll get at doing it. So fresh smears at the time of phlebotomy can be incredibly helpful, particularly with staining characteristics, or if we get problems with samples clotting in the post or deteriorating post-sampling. I generally use a slide-on-slide technique where I have a spreader slide that's slightly narrower than the slide I've got the blood sample on. You can buy these with little beveled edges, or you can file them down, because generally a box of these is more expensive. But you can, once you've got your spreader slide, you don't need to throw it away. Just clean it and use the same one again and again, and the more you use it, you'll actually get better slides, because instead of having a sharp edge on the edge of the slide, it will round slightly and it will run more smoothly. Having the bevel on each end, on each corner, i.e. it's narrower than the slide you've taken the smear on, makes it easier to make sure that the smear doesn't reach the edge of the sample slide. And generally what you need to do is hold the upper slide, which is this one, at approximately 30 to 45 degree acute angle. That gives a narrower film, but if you want to make sure that it's not too thick and you want an even distribution. So you want to basically put your little bit of blood spot on there. You put your spreader slide on the slide, reverse it up until it just touches, and capillary action spreads a good volume across the width of the slide, and then in a nice steady smooth continuous action that's put the other bits on, but it'll give you the information. It moves smoothly and it gives you a nice feather edge to your slide. The more you do them, the easier it will become and the better they'll be. So as everything, practice makes perfect. As you can see with my picture here, this is where I've just had a bit of spirit before because I was degreasing them. I usually make at least 2 or more, and then I select the best 2 to send to the lab. So you want to have a nice tapered edge, and it's around this tapered edge where you've got a nice uniform thickness of smear that they'll actually do the counts from. So we now know what we need to do to get the bloods and what to do with the blood. What do we do with the patient? Well, we need to prepare them in the same way. So we need to stabilize the patient, same as you would with a cat or a dog. Or if you don't, you need to interpret the values in view of the conditions you see. So if you've got a collapsed cat or dog and you're not sort of doing your fluid therapy and this, that and the other, you'd expect to have hemo concentration that will impact the values that you get from the lab. With reptiles, we also need to bear in mind that if they're hypothermic, it's going to affect the circulation, particularly with reptiles, but yes, admittedly with other species as well. So we want to get them normothermic, ideally. We want to get them appropriately hydrated, but all right, we can't often see whether they're hydrated until we've assessed a hematocrit, and that's less simple in exotic species because they have a smaller blood volume. Ideally, we want reptiles within their preferred body temperature zone. So when clients come in, a lot of the reptiles get brought into me. They're not brought in on hot water bottles or snuggle safes. They're cold to the touch. That's not within their preferred body temperature. That's going to make blood sampling more difficult for me and less value for the patient. It's the same way as if we sample a dog and cat that's hypothermic. So ideally, get them warm. What I'll do, if they're that cold, I'll stick them in, admit them, stick them in the viv, get them warmed, and then we'll sample them. It makes them much easier. It also makes a better value sample. So bear with me a second. So once we've got them stabilized, where can we aim to get the blood from? Which is possibly what a lot of people have been waiting for, and I've been dragging out for this evening. So for Chelonia, the primary site I go for is the jugular vein. The reason for this is that there's a minimal chance of lymph dilution. The vessel is superficial, and if you put pressure at the thoracic, and I say thoracic, they don't have a thorax because they don't have a diaphragm, but that's what it gets called. So just at the base of the neck, it may help the vein stand up and aid visualization. It may be after the sample we need to ensure that we've got hemostasis, otherwise we can get significant hematomas. And basically all you need to do is put a compressive bandage around the neck, but not so tight that this bit can't continue to breathe. So fortunately I don't need to use it that often, but we'll do that and we'll have them in for a little bit to make sure that it has stopped, and then they can still move the head around if needs be. So where is this jugular vein that I'm talking about? This is on a giant tortoise. This is on an aldabran. The blue line indicates approximately where the jugular vein is. It is superficial, and it is roughly on line of where we would expect the tympanic membrane to be. The red line illustrates approximately where the carotid is. So if you're dorsal enough in the neck, you've got no chance of hitting the carotid. You may be able to visualize it in easily, and we can see here we've got the tympanic membrane just here, and again at the same level where all the little black arrows are, we can see where this superficial vessel is without needing to occlude it by putting pressure at the thoracic inlet. So you can either do it with them in the normal orientation. For some species that makes it easier to sort of deviate the neck to one side, you can do them on the side. This is on a marsh turtle. And again, you can see even here, it's a very superficial vessel, but we are able to sample it. Or we can do it, this is on a Greek tortoise, we can just about see the vessel. The occlusion is helping. And yes, it's not full of blood like this one, but we can actually see there is a little bit of blood in the hub. So it shows that I am there. I haven't just stuck it vaguely into the tortoise's neck. So this is where we're aiming. But it can be, if you don't get this side, you can always aim from one on the other side. I always personally, being right-handed, I find it easier to go for the left, but personal preference. You can also go for what's called the subcarapacial sinus, or also known as the subvertebral vein. It's midline below the cranial aspect of the carapace, just above the caudal cervical vertebra. You insert the needle at the junction of the skin and the shell and advance it dorsocaudally until blood is aspirated. However, there is also quite a big lymph sinus here as well, so as you go through with your little bit of negative pressure on that I mentioned before, it may well be that you'll hit the lymph vessel first and you'll see it enter the blood, in which case come out and try again. There is a pretty high chance, but being aware of it, or been aware that this is a site, it can be helpful for individuals that don't want to play nicely. It can be sampled with a head extended or retracted. So this one, I've been honest, I couldn't get the jugular. You'd think I would be able to, because it should just be there. I can sort of see it standing up. Could I get the needle to stay in or get the sample? Would it accept it? No, I couldn't. So we're going for the subcarapacial, and we're sort of aiming for this area here. Head extended. If you've got those that don't want to play, well, equally, you can do it with a head in as well. So other sites that you can go for with Chelonian or consider, and I put it with a big question mark because there are a number of significant cons to doing it, but I mentioned earlier the dorsal coccygeal vein. It's not easy to get a big volume. Well, it is basically, it's dorsal midline above the vertebra, so same as if those of you that done any cattle work, the same as the one below, and we'll talk about the coccygeal vein with the lizards, but it's dorsally. But it's usually with tortoises, it's really quite contaminated with fecal material, so it's not a site that I would particularly advise going for. All the sites that are reported, the brachial vein, the femoral vein, the heart is in very young individuals that have got a soft shell. You can go between the scutes on the plastron. It's not something I've done, and potentially the carotid artery, but yeah, the hemostasis issues when you're going for arteries and stuff like that is yeah, not insignificant. So we always go for venipuncture for samples. So for lizards, primary site that we'd go for is the ventral coccygeal vein, i.e. the tail vein. Same as for those of you that might have done cattle blood testing. You want to be proximal enough for the vessel to be of a reasonable size, but also, I say distal enough to avoid the hemipenes. The hemipenes should be lateral, so you should miss them, but if you go just caudal to them, it prevents any potential complications. So generally speaking, as we showed before, where I was prepping the bearded dragon, I'll go for a midline ventral approach. But if you've got species like chameleons that have got a laterally flattened tail, you can go for a lateral approach. It's the same approach where you're aiming. So basically what you want to be doing, if you're going for the ventral approach, you want to be putting the needle midline at either a 45-degree angle is my preference. You can do a 90-degree. You're advancing the needle so it passes between the scales when you go in, but then you're also going so that it passes between the ventral spinous processes and gently contacts the vertebral body. A little bit of negative pressure is applied as you slowly approach it, and then hopefully as you go in you'll get blood as you go. If you go as far as hitting the ventral surface of the vertebral body, you want to come back a little bit with your negative pressure still in situ, it's still there. If you're going for the lateral approach, it's the same part where you're aiming, but instead of sort of going up, you're going in laterally, so that you're trying to get the vessel just below the ventral or vertebral body. If you go in, you want to place it perpendicularly, angle it ever so slightly. Then once you're in, angle it slightly dorsally until it contacts the bone, and gradually relocate it until you get blood flow occurring. For things like leopard geckos, there are a number of clinicians that I've spoken to that sample from the tail. You need to be very careful because they can perform autotomy, i.e. they can shed the whole tail. When that happens, it's quite dramatic. I euthanized one once by the tail vein, and I now use that, the way the tail moves, in my lectures to show just how dramatic it can be, and how much it can wiggle around for. So be very aware of it. So here we are. We were preparing the beardy before. As you can see, the observant was I probably wasn't successful with the first needle, so we get another one, and we're going in the midline. You can carefully see I'm going between the scales, and we're getting a good 1 ml sample from it. All the sites that are discussed is a jugular vein. It runs from the point of the shoulder to the angle of the jaw. In the smaller species that I'm seeing, to being honest, is it a site that I really go for? No, it's not, because I'm generally successful enough with the tail vein. There's also in text, you'll see them talk about the ventral abdominal vein. It's a bit of a blind stick. It's within the coelom. If you once you've stuck it, there's no way that you can control any hemorrhage. And they'll talk about cardiac sampling, cardiocentesis. It's not something I do in lizards for phlebotomy, but it can be useful during anesthesia. It's more proximally positioned, sort of more around the pectoral girdle side of things, and this is an individual that is, to all intents and purposes, not quite dead yet. It's heavily anaesthetized from having an overdose via the tail vein, but we've still got a positive Doppler. So in order to try and speed things up, I'm using an intracardiac injection to give a top-up of the pentobarbital. There's also reports of using the brachial plexus that is reportedly of use in some species. It's not a vessel that I've gone for, so it's not something I can give advice or comments on. Snakes, again, if it's a big enough snake, I'll start with the ventral coccygeal, so ventral tail vein, so the same as we would do in lizards, same approach. Make sure we're caudal enough to the cloaca to avoid any hemipenes and those sorts of things. Here we are, midline with a nice sample. However, I have to be honest and say it can be quite frustrating that even some big snakes have some frustratingly small tail veins, and we can't always hit them, so we may well go for a cardiac sample. Whilst it's recognised as a routine sample site, there's alarm bells that go off in my head that mean we shouldn't be complacent about it. Sticking sharp things into an animal's heart isn't something that should be done lightly. We are fortunate that with reptiles, they have the 3-chambered heart, although it can act as a 5-chambered heart, but the muscular wall is much thicker, and therefore the potential for morbidity and mortality associated with the cardiocentesis is reportedly significantly less due to the thickness of the ventricular wall closing the hole that's made by the needle. But still, be aware, sticking something sharp into an animal's heart, it's not something to be done lightly. The most challenging thing often is finding the position of the heart. It's very variable and movable. It, generally speaking, is between 22 and 30% of the body length. You need to locate it either visually, if you've got a number of assistants. I'll often have the snake held, and we're looking underneath, and we're looking for scales that are moving regularly. If that's not successful, we'll sometimes use a Doppler or potentially an ultrasound. So this is an anaesthetized snake. We're not bleeding it. The observant ones around, you'll see that there's a great big bit of potential nastiness here, and that's why it's in the anaesthetized state. But I'll use the Doppler as an anaesthetic monitoring device. Same principle to find where the loudest whoosh, whoosh, whoosh is, and then keep a visual check on where it is. If you get owner permission once you've seen it, you can sometimes put a bit of a permanent marker on a scale nearby if there isn't a particular scale pattern to show you where it is, so that when you've cleaned it, you still know where you're aiming for. You can stabilize it by putting gentle pressure, digital pressure, usually the thumb just caudal to it, so between the rib heads, push down ever so slightly so that the ventral scales bend. Go between the scales, really important, always between scales, help prevent scarring. A 45-degree angle, gentle negative pressure. Once you enter the single ventricle, you want to remain static relative to the animal, which can be difficult when you bear in mind that heart is beating. If necessary, you apply your negative pressure synchronized with a heartbeat, i.e. when the ventricle fills, you can take a little bit more. And as I said before, generally speaking, good technique is associated with minimal morbidity and mortality. And you can see here, got the thumb, stabilizing the heart, we're going through between the scales, and yet again, we're just pictures taken just as we're starting to get blood in the hub as part of the sample. Other vessels that are reported is the palatine vein. Generally, really, it's only an option when the animal's under anesthesia. Very delicate vein and potential for hemorrhage. and we can see it here. I'll be honest, why this one's bigger than the other on this individual, I'm not 100% sure, but that's not necessarily what you want to be looking for. So moving on to birds, my preferred site is to go for the superficial ulnar or basilic vein, which is the one that runs just over the elbow. This is in a tawny owl. This is in an otherwise pretty much oven ready macaw. So it's very helpful to be able to see the anatomy, but it's also readily visible in a little white dove. Again, you can see here I've pre-bent the needle to try and help my approach angle. So again, once it's in, you can see it. Sometimes occluding the vessel more proximally can help, but once you're in, you want to stabilize things. This is resting against my thumb to stabilize the syringe as I'm pulling the plunger. We don't want that needle end moving around and causing damage. You can go for the jugular vein, another tawny owl. This isn't a plucked area. This is using, there is an anatomical site called the aptera, which is a featherless area within birds. Use that to your advantage. A little bit of minimal spirit can spread the feathers away. It then basically can form a little window. The skin can then be moved over the jugular vein and we can access it. And as again, you can see I've pre-bent the needle so that I can get access to the vein. This is similar approach, but with a straight needle. This is on a penguin, still going for the jugular. This is a bit more of a blind stick. We can't see it. And basically, we're gripping here to get all the anatomy, trachea, etc., all in one plane so that I can go for where the jugular vein is. You can go in some species, the medial metatarsal vein. We can see it here. This is, I think, if I remember right, this is a small plover. But if you're going for something like a swan, I don't like tempting fate. And there's a rule in the practice I work in that you don't comment upon vessel size until after you've got the blood sample or you've catheterized it. But for swans, they have pretty big hose pipes. But this is also another site that can be very handy in things like pigeons and things to use as an access site for euthanasia. You can technically go in some species for pedal or digital vessels. Again, this is on a penguin. It's not my preferred site because, as we can see, trying to ensure asepsis is not simple. So moving on to rabbits. My primary site that I would go for is the lateral saphenous. We can see it clipped carefully and we can see it standing up here and standing quite proud as it runs up the leg. But do be aware, it is a delicate vein and can bruise readily, so make sure you're ready for hemostasis. You can quite have the cranial end of the rabbit up in sternal recumbency and then just have its hind leg in a bit more in lateral, and they're incredibly tolerant. I prefer to just use a needle and syringe as I would with a cat. I know there are a number of my colleagues that prefer to use butterfly catheters, but it's a nice ready site both for blood sampling and for giving fluid therapy in debilitated individuals. You can use the jugular similar to cats, as we can see here. So over the edge of the table or with an assistant holding in their armpit, head and neck extended upwards, legs forward. But the dewlap in females particularly can make it quite awkward because it gets in the blooming way. All the sites that you might think about, well, I'll be honest and say caudal ear vein, it's too small really for taking stuff out. It's great for adding things to. So I'll use it for fluid therapy, but because it's so small, it impacts the laminar flow properties of the blood, and therefore it'll affect, you don't get a good quality sample in the same way that if you go for a cephalic in a cat, it's not as good a quality sample as going for a jugular sample. So you can use the cephalic vein to give stuff for inductions or for fluid therapy, but like I say, not for taking stuff out. We're moving on to ferrets. Again, jugular sample or the anterior cavia for large volumes. I'll be honest and say my preference is for the jugular. I always get a bit nervy about sticking things into anterior cavias. Maybe that's just me, but the approach can be similar to cats. So you shave the neck, extend the forelegs, restrain the head in an upward direction, prep the site, and yeah, all right, the observant ones will see there's no blood one in this one, so I could just be sticking it anywhere. But trust me, this is where we did get a sample from. If you've got an animal that's not used to being held, surprises me the number that will tolerate it. But if they're not happy to be held and restrained, then we can do the same approach under anesthesia, and we can just see the mask here. For the anterior vena cava, or the branch that drains into it, you're wanting to insert the needle into the thoracic cavity between the first rib and the manubrium. You want to direct it to the opposite rear leg or the last rib and insert to the hub, and gradually withdraw with a slight negative pressure. And as you withdraw, you should then get back into it and get your blood sample. If at any point there is any struggle, you need to remove your needle and wait for the ferret to settle. Your jugular sampling can be done either, say, in the conscious or the unconscious patient. If there's too much struggling, it's stressful both for the animal and, being honest, for the phlebotomist. So I'll often just do a quick chamber induction with SIVO, and when I say quick, it's because sevoflurane is more rapidly effective in gaseous induction, and also it's less of a respiratory irritant. When you're doing the anterior cava that I described before, it's important that you have the dorsal recumbency, have your forelegs drawn caudally, your head and neck extended. Other sites, well, you could go for a cephalic vein, but again, same with cats, you get a poor quality sample, so it's fine for putting catheters in, to give fluid therapy and that sort of thing, but it wouldn't be my primary site for trying to get blood out for hematology, biochemistry and those sorts of things. Lateral saphenous vein, yeah, it's okay for smaller volumes. For example, if you just want to check a PCV or a glucose, but otherwise it's not ideal. Guinea pigs and chinchillas, well, yeah, they can be a bit more of a challenge, I'll be honest. You can go for a jugular sample. Similarly, forelegs extended, head and neck extended. But guinea pigs, if you've not noticed, they have pretty short little compact necks. So cranial vena cava, you have the similar hemorrhage concerns as you do for ferrets, or you could go for a lateral saphenous or a cephalic, but again, you only get small amounts of blood as they're very small vessels. I'll be very honest and say my clients don't want to fund me to blood sample the guinea pigs very often, so it's not something that I do on a regular basis. That's not the same for a lot of clinicians, because we do get a number of guinea pig samples through the VPG. It's just that, yeah, maybe they've got those vets have got clients that are happy to pay for it. I don't have that luxury. Rats are surprisingly easier, although they're smaller, and go for a lateral tail vein. If needs be, you can warm the tail up a little bit, that can help. So that's surprisingly simple. Other sites, well, we're talking about lateral saphenous veins for gerbils, and reportedly we can get 0.3 mils from a gerbil, 0.65 mils from a hamster, almost enough there for a full profile, 0.14 for a mouse, and about 1.3 for a rat. But I'll be honest, with a rat, I would tend to go for a lateral tail vein. For the more exotic zoo species that I see that you might not be, I'll often go for a femoral vein. As I mentioned at the beginning, we're palpating the femoral triangle, we're feeling for the femoral pulse, and effectively it's a blind stick, and we're aiming near the artery but not at it, and hopefully we locate the vein. Occasionally we'll catch the nerve and the leg will twitch, but it's a recognised site. Hopefully that's giving you a bit of a run through, taking the fear away from things. That's it for what I've got to say for this evening, unless of course there are a number of questions which I'll be happy to answer if possible. And hopefully over to Zoe.
Yes, we do have a few questions for you, Ian. So first question, can you use insulin syringes like a 0.5 mil?
The simple answer is yes, but I would advise against it. because you can get this, the 27 gauge needles are just as small. The difficulty in using an insulin syringe is that you then can't take the needle off to put your blood sample into your sample pot, so you run you have an increased risk of hemolysis as your blood passes through that small constriction for a second time. If you're really struggling, then yes, use an insulin syringe, but what I would say is have a pair of dog clippers handy. Pull your plunger down as far as you can, dog nail clippers, cut the needle off that way, and then introduce it into the sample pot that way, and you'll reduce the risk of hemolysis, even if you've got the biohazard of cleaning the blood off your clippers.
Okay, perfect, thank you. Next question. Do these statements, such as heparin in the needle, but don't put the blood in the heparin tube, apply to mammals too, such as cats and dogs?
Take the needle off, definitely, with any species, because you're removing that restriction. And what was the other aspect of it, did you say, sorry?
So putting heparin in the needle, but don't put the blood in a heparin tube, does that apply to mammals too?
With cats and dogs, usually you're getting enough sample that you can do a heparin and an EDTA. It's only in the smaller species where we have a limited volume that we need to primarily put it into the heparin initially. Hopefully that answers the question, I think.
Yeah, and the next question, can you make smears with lithium heparin blood, or does it have to be EDTA blood?
The simple answer is, I'm a clinician, not a pathologist. The simple answer is you can make smears from both, but a fresh smear made at the time is preferable to both of them, because your staining properties and everything are so much better. Because basically a good smear made at the time gives you the snapshot of that then. There's no chance of deterioration, whether it's in an EDTA tube or whether it's in a HEP tube during transport and everything like that. A fresh smear, getting into the practice, dog, cats, whatever, getting into the practice of making a couple of fresh smears at the time will give your hematologist much more information. It's incredibly helpful, and the more you make them, if you're doing it with all your cats and dogs, you're going to be familiar with doing it with your exotics, and you'll get better quality smears. So it's a win-win. I can't stress enough. Fresh smears made at the time can make such a big difference. For example, we get a lot of comments, and then we can get a platelet clumping or our platelet numbers. Looking at a good smear, if they're not clumping, the hematologist can say, no, the numbers look fine, we don't need to worry about it.
Okay, thanks. Next question. Do you have any videos of blood extraction on a bearded dragon?
Not videos, no. I could try and put the images together and flick through it like a flicker book, but it's if there's aspects that people would like help, if they contact the VPG and we can try and help them subsequently. If it's those sorts of things would be useful, then we can. I don't have a problem. I can speak to my clients and try and get permission from them, and we can try and make them. If there's a site on VPG on the website that we can put this sort of useful information, we can try and do that if there's enough interest, as far as I'm concerned.
Yeah, for that question, we've actually put our email addresses in the chat. So if you would like a video, just email either myself or Ian and we can look at that for you. Okay, so next question, do you have references for normal values ranges of blood chemistry and CBC?
For what species?
We don't have a species in the question.
Right. So what's happening at the moment, we're very proud to be able to say that I think it's in the last 12 months or so that VPG have partnered with ZIMS or Species 360. For those of you that are unfamiliar with Species 360, it's primarily a zoological database, but it's a worldwide database. It's now including fish and things. I'll be honest, I don't do fish, but it is we're fortunate that we are now partnered with them, and as a general thing, we are using the ranges that are available on their system to interpret the results. At the moment, the computer systems are changing, so if you're sending stuff in for a number of species, you won't get ranges printed out, but the comments, if the species are identified, the comments are made viewing the available data that's on Species 360 and a number of other papers and publications. Basically, there's not a lot of information out there for a lot of these species. There's no way any lab in the world can have its own reference range of having a sufficient number of healthy individuals to a sample to establish their own reference interval. So we'll use the term ranges. It's not a reference interval, and some of it needs to be interpreted cautiously, but it's as close as we can get to the evidence-based medicine. Yes, the company is in the midst of updating computer systems and the sort of significant database that we need for this. It's not an overnight process. We are in the midst of doing it, and I am still hopeful that maybe in the next 12 months, 2 years, the sort of what's called the limb systems behind the scenes are being updated, that mean that a number of the data that we've harvested we've got ranges for over 500 different species, but it's not an easy thing to stick them all onto the system at the moment because it's a DOS system, so we'll have to, and retrospectively affects things. It's something that I'm really excited about that going forward will occur. That was a very long answer to a short question, sorry.
All right, typical that. There's a few questions here actually about the recording. So everyone who's registered will receive a recording by email, and those who attended this evening will receive a CPD certificate as well. There's a few questions about that. And that question for you, Ian, what is or are the injectable sedatives do you usually use if the gas anesthesia machine isn't available?
Again, that would depend on what species. So for a lot of avian species, I will use volatile agents. So I see a lot of parrots, so cytosines. So I will induce them with isoflurane. They're usually rapidly asleep sufficiently for anaesthetize, I should say, bad me, in order to sample them, x-ray them, and those sorts of things. There's not that, because we've got the rapid changes with that. I will do most of the exotic zoo animals. I'll do the mammals. I'm doing they're done with sevoflurane because there's less respiratory. The zoo I look after, we have a number of induction boxes that's made for them. Again, sevoflurane has got the minimal respiratory irritation, so they'll be asleep with that. And for other species that I use, so I use injectables for anesthesia, for example, for rabbits, but I can sample them conscious. So it's not something that I do very often. Most reptiles, they'll tolerate it in a conscious state as well. Difficult ones, yeah, you're probably thinking of something like some of the tortoises. Things like the things that jump to mind are things like leopard tortoises. They are a bit of a pain because they can have their front legs, their back legs, and their head, and close the shutters. So with those, I would probably use something like alfaxam because it's effective intramuscularly, even if you can't get vein, and you can then get on a lower dose. It'll sedate them enough for you to be able to access them that way. But snakes, again, generally don't need to do that because you can go, if they're that big, you can get a tail if you have enough people holding them. And by enough people, I mean if you've got a 20-foot snake, you need a few people to hold them. Otherwise, yeah, if you're on the end of that, you'll be thrown around like a rag doll. And again, most of the reptiles, you can hold the legs and go for a tail without having to drug them particularly.
Okay, great. Next question. Thank you for the seminar. What anaesthetic protocol would you recommend for taking blood from parrots? Okay,
so with the parrots, I give the owner the option. Well, for the blood sampling, I do it away from the owner because I'm using a volatile agent, so health and safety and all that. But when I'm looking at them, I wrap them in a towel. I usually advise owners are away from that because a lot of the parrots that come to see me hate me because I put them in a towel and just wrap them around. They can chew the towel. I'm protecting the feathers with the towel. I encourage my clients to get them used to being cuddled and given treats in a towel so it's less stressful. We then put a mask over them without the rubber on because they'll chew through that in an instant. And we put them on isoflurane and most of them will be asleep within 30 to 60 seconds or on that way to be anaesthetised sufficiently. So it's quite a rapid induction, minimal going through stage 2, so minimal excitement, minimal stress for them, and then we can do what we need to do, and we turn off the volatile agent, and they wake up. If they're relatively healthy in a not dissimilar state, the longer the recovery, the more concern I have that they have an underlying illness. And something actually that I didn't say during the talk, which I did forget, so I do apologise. With birds, my preferred site is the ulnar vein. If I can't get an ulnar vein on the majority of the parrots, and I'm talking, you know, Timney Grey, big parrots, not budgies and things. If I can't get an ulnar vein and I have to go for a jugular, that usually indicates to me that it's really not healthy, and I tend to get much more significant pathology signs on the bloods that way. So I always go for a wing vein first. But it is a site that if you don't make sure that you've got hemostasis, I'm not sure whether you can see it on the camera, I'm doing it on my elbow, it is a site where they can bleed out. So it's only a small vessel, but make sure it stops. I had one relatively recently. It was a blue and gold macaw that we were sampling to make sure that the infection was gone, and the first 2-3 samples were fine. The fourth one, I had to apply pressure on the vein for about 35 minutes afterwards, and that came back that it was then healthy. It did bruise, so make sure that you've got total hemostasis before you wake them up. But there's been no advantage to you shown to using sevoflurane. If that's all you have in the practice, then use it. It's just more expensive. It's not a negative. It's just there's no advantage to using sevo, that sort of published stuff. So that's why I tend to use the isoflurane. And I use sevo for ferrets, rats, a number of primates that I deal with, and guinea pigs and those sorts of things.
Okay, thank you. So moving on to the next one. Sorry if you already said this and I missed it, but can the tortoise bloods be taken conscious?
Absolutely. I didn't say it particularly, but the vast majority, reptiles, I'm doing conscious. Yeah. It can be a challenge to get the head out on some, as I said before, but the vast majority, tortoises are great actually for, in some ways, doing your diagnostic workup, because you can bleed them conscious, you can x-ray them conscious. I usually joke with my clients that although we're doing 3 views, we use a high-tech tortoise restraint device that enables radiography, and basically you just balance them on a tin of dog food so that the legs can't touch the table, they can't wiggle off it, we can step out of the room, press the button, we don't need to anaesthetise them to position them properly, unlike dogs and cats.
Okay, thank you. Next question. What is your recommended method to blood sample species that undergo autonomy, so like a leopard gecko? Do you still use the tail vein, and do you warn clients of the risk or aim for another vein?
I'll be very honest, and it's a bit like the guinea pig side of things, I don't have many clients that come to see me with leopard geckos that have the funding ability for the lab fees. So I don't do it, I'll be honest. There are others nearby that do it, and they use the tail vein, and they haven't had problems. When I've used it as a site for euthanasia, maybe it's the irritant factor of pentobarbital that was the trigger to the autotomy, I don't know, but it always makes me worry. The difficulty is in a 45-50 gram leopard gecko, taking 10% of its circulating volume, so call it 50 grams, 10% of that circulating volume at best. We said in the talk it was 5 to 8, but just makes the maths easier. You're looking at 5 grams, you're looking at being able to get 1/2 a mil at best. So the difficulty then is, what do you then target for what you actually want to sample? But yeah, if I was struggling, I'll be honest, I'd probably go for a tail vein, but as the question raised, I would be very open with the owner that it may occur. And again, it's all down to informed consent. If you've explained it and document it in your clinical notes that the owner was warned before they signed the consent form. I'm a dinosaur, but it ain't the same world that I qualified in. We need to be very careful about making sure that owners are aware of what we're doing and why we're doing it and what to expect, so that we're all on the same hymn sheet.
Okay, thank you. So next question, can you use the 1 ml syringe trick in these animals, so where you remove the plunger and allow the blood to flow itself without the negative pressure to collapse the vein?
That side of things, I'll be honest, I'm not a fan of. It would concern me that there's more chance by the time it dribbles down the syringe, more risk of clotting and things. In that instance, I don't use them myself, but I'd be more inclined to do what some of my colleagues do over the years, and actually just use a butterfly catheter rather than a 1 ml syringe, and just have the butterfly catheter over so it drips into your tube that way, because then the tube coming from the vessel is narrower as well. So hopefully a bit of blood, the little bit of blood pressure that's in the vein will fill it more quickly, rather than it dribbling into 1 ml syringe and potentially clotting. But it's not an issue that I have problems with.
Okay, thanks. Next question. Do you have any books or a PDF we can use as a reference?
We can send out a PDF that gives, it's an in practice article that I wrote on phlebotomy in reptiles and avians. We were discussing just before we launched. We can get that and send that out. For mammals, I'm not aware off the top of my head. I'd just say there's advice within the sort of relevant BSAVA manuals.
Thank you. Next question. Here in Norway, there are almost no lectures or courses on exotics. It's not really any different here either. Could you recommend anywhere to do a short externship? Maybe answer by email if you don't want to take this in public.
On the externship side of things, I'm happy. I stick my head against it over the parapet a lot of times. It would depend on where people feel that they're doing sufficient numbers to make it worthwhile. With that side of things, I would suggest a place to start might be worth contacting the British Veterinary Zoological Society. They might be able to put something out to people, and therefore it's something that may come of that. Or yeah, contact me. I'll come out to Norway and do some lectures if you like. I love Scandinavian.
Okay, one last question. How do you avoid reptiles shedding their tail during sampling?
I can't see my webcam, but a little bit like that. I don't know whether you can see it, but I've got my fingers crossed. It's usually the small things like the leopard geckos. To be honest, if it was an iguana, I'm not unduly worried about it. They can perform autotomy, but they're big, robust beasties. I don't worry about that. It's the small. It's usually sort of leopard geckos that I hear colleagues saying, "Oh yeah, I sample from the tail," and I go a little bit pale because my experience was not good. So yeah. Whereas it's a standard thing before with say you got iguanas with tail injuries, just anaesthetize them, and it's the most unfinesse of a job, and you just hold the tail. You can, with some species, you get a vague look. You can see roughly where you're suspicious. You get these lines where you're suspicious that the cleavage planes are on something like an iguana, and you can hold one end, hold the damage end, and literally just do a sharp twist as if you're wringing out a towel or something to amputate the tail, and that'll heal much more effectively, quicker, better than if you did it surgically. But yeah, the first time you do it, it makes you think twice. I'm not sure whether that answers the question, but that's as best as I can manage. You just, yeah, keep your fingers crossed.
Okay, well, I think that's all our questions for this evening. Any further questions, please do either email Ian or myself. Our email addresses are in the chat bit, and they'll also be sent to you in an email. So one last question actually just come through. Will the tail grow back?
We're talking geckos, yes. It's quite interesting that if you're x-raying a number of leopard geckos, you'll be surprised how many tails sort of look normal, but then when you x-ray them, the coccygeal vertebrae stop and then beyond that point where it stops, you get what's called a fibrocartilage effigy of what the tail was. They're really quite cool little animals, but I have to say, from a point of view of phlebotomy, it's recorded, I nearly said something I shouldn't, they're quite the challenge. Blooming awkward, perhaps, is what I was about to say.
Okay, I think that is all our questions now. So thank you so much to everyone who's joined this evening. We'll send you a copy of the recording and a certificate for tonight. And yeah, any further questions, please email either Ian or myself. Okay, thank you very much, everyone. Enjoy the rest of your night.
Bye-bye.
Bye.